Hello, we are group 4 and we will be talking about the stomach. So this presentation will cover the contents of the digestive system and the stomach, the anatomy and histology of the stomach, and the pathology of the stomach. We will explore one of the most important organs in the digestive system, which is the stomach. So what is the digestive system? The digestive system is made up of the gastrointestinal tract, which contains the mouth, esophagus, the stomach, small and large intestines, and the anus. So these group of organs work together to break down food into smaller molecules, which provides energy and nutrients to the body. So as mentioned previously, the stomach is a part of the digestive system, and its main functions is to store food. It uses both chemical and mechanical digestion. So it mechanically digests food using the muscular contractions, and it chemically breaks down food using the stomach acid, which contains the hydrochloric acid and the enzymes. So the stomach is a J-shaped pouch. It is located at the upper left of the abdomen, and it sits between the esophagus and the small intestines.
So now I will be talking about the mucosa layer, which is the innermost layer of the stomach wall, and it is made up of the epithelium, lamina propria, and the muscularis mucosa. So let's take a look at lamina propria first. Lamina propria is made up of connective tissues, blood vessels, and lymph vessels, which is shown in the top left corner image. Next up will be the epithelium layer, which is the outermost layer of mucosa, and it contains multiple specialized cells that helps in digestion. First up is the mucous cell, and it is divided into surface mucous cell and also the neck mucous cell. By its name, we know that it secretes mucus to protect the epithelium. Next up, we have the parietal cell, which is labeled in blue color here, and it is used to secrete hydrochloric acid, or for short HCl, to help in digestion. Hydrochloric acid will break down larger food particles into smaller ones so that it is easily absorbed by the small intestine after that. And then following would be the ones labeled in pink color, which is known as the chief cells. Chief cells secretes pepsinogen to activate pepsin, which is an enzyme that is used to break down or digest protein. Last but not least, we have the G cells that secretes gastrin. Gastrin is a type of hormone, and it is used to signal the parietal cell to secrete hydrochloric acid to start digestion. Next up, we have the muscularis mucosa layer, and it is divided into two, which is the circular layer and the longitudinal layer. It is mainly made up of smooth muscles, which helps in the contraction and relaxation of the stomach, which is part of the mechanical digestion of the stomach. And the image at the bottom shows the overview of the mucosa layer in the stomach wall. The picture shown in this slide is a simplified drawing highlighting the specialized cells found in the stomach wall that is important for digestion in the stomach. In this slide also, you can see the histological slide of the parts of the stomach wall, which is the lamina propria, the muscularis mucosa, the parietal cell, the mucous cell, and also the chief cells.
Hi, I'm Kenzo, and now let's talk about two important layers of the gastrointestinal tract, which are the submucosa and muscularis externa. The submucosa is located below the mucosa. It contains nerve fibers, blood vessels, and lymphatic. It houses the submucosal plexus, which is part of the enteric nervous system. Histologically, it's made of 10 irregular connective tissue. It may look loose under the microscope, but it is strong and connects the mucosa to the muscularis externa. Onto the muscularis externa, which is responsible for mechanical digestion and peristalsis. In the stomach, it has three muscle layers: the oblique layer, the circular layer, and the longitudinal layer. The oblique layer is the innermost and unique to the stomach. Its diagonal fiber help to grind and churn food. The circular layer runs around the stomach and helps to constrict the lumen to move food forward. The longitudinal layer, the outermost, shorten the tract to proper content by peristalsis. Between the circular and longitudinal layer lies on enteric plexus, which controls muscle contraction. So here are the histological slides of the submucosa and muscularis externa layer. As you can see, they are pointed out with black colored arrows, and that's all from me. Thanks.
Hi everyone! Today I'll be talking about serosa, and I will be explaining where is it located, what is it made of, and what are the functions. So as we can see in this photo, serosa is this thin and slippery layer which is located in the outermost layer of the stomach wall, and it is mostly made of the simple squamous epithelium as well as the connective tissue. It is also a part of the visceral peritoneum, which means it can be covering and the coating and the protection layer for the stomach. It also helps to reduce the friction of the stomach when it moves and expands during digestion. This layer also secretes a fluid known as serous fluid, which is really important in order to preventing the sticking of the stomach to nearby organs and tissues such as intestine, abdominal wall, and the liver. So in short, this layer is really important in order to help protection and covering for the stomach, as well as give it freedom in order to move and expand without irritating and damaging nearby tissues as well as the organs.
Hi, I'm Sarveetha, and today I'll be talking about the gastroesophageal reflux disease, which is shortened as GERD. So GERD is actually a disorder in which the stomach acid flows back into the esophagus. So how does it occur? So basically the LES, which is the lower esophageal sphincter, which can be also called as muscular valve, will become weak and it does not close properly, which will allow the food to flow back into the esophagus. There are some complications of this GERD. So basically the commons are the heartburn, irritation, and also it damages the esophageal lining. So the symptoms of this GERD disorder is the chest discomfort, the sour taste in the mouth, and also the acid regurgitation. So what are the factors of the GERD? So basically lying down after eating and also eating a lot of spicy food and fatty foods, and overeating is also some common factors. So to cure this disorder, we are supposed to avoid eating the spicy and fatty foods and also stay upright after eating and eat smaller portions. So the attached picture shows the comparison between a normal esophagus with a person who's diagnosed with GERD. So the first picture is the normal esophagus where it appears smooth and healthy, and the other two pictures shows the damages caused by GERD, especially the parrot's esophagus, where the condition chronic acid reflux changes in the tissue lining, which may lead into the inflammation, ulceration, also increase the risk of esophageal cancer.
Let's talk about peptic ulcer disease. Peptic ulcer disease is a condition whereby open sores called ulcers form in your stomach lining and duodenum. This is caused by pepsin and stomach acids used in the digestion of food, which breaks down the mucosal protective layer of your GI, corrodes the lining, and penetrates all the layers of the mucosa, which results in an ulcer. Another cause of this is by a bacterial infection caused by Helicobacter pylori, which leads to irritation and inflammation, which can then induce ulcer formation. It can also be caused by chemotherapy or radiation therapy, Crohn's disease, and stomach cancer. Peptic ulcer disease is diagnosed by blood tests, urea breath tests, biopsies, and endoscopy. Its symptoms include nausea and vomiting, excruciating stomach pains, a bloated stomach, loss of appetite, and heartburn. It can lead to upper gastrointestinal bleeding, bloody stools, an increased heart rate, dizziness, paleness, and even fainting. To treat peptic ulcer disease, antibiotics are administered to overcome the bacterial infection, and medications with cytoprotective agents and proton pump inhibitors are also used. Patients should avoid smoking, alcohol, and stress.
In summary, we have looked at the anatomy of the stomach, exploring the different layers, which is the mucosa, submucosa, muscularis externa, and serosa. We have looked at these layers and learned the different functions and learned that it all combines to make up the stomach. Next, we have looked and learned about GERD and the peptic ulcer disease, which are the clinical diseases that affect the stomach. We learned what it is and the causes and cures of it. So, in conclusion, the stomach is an important organ in the digestive system and the GI tract. The anatomy of the stomach is perfectly made to aid the digestion of food to its muscular walls and acidic environment, which means that if anything were to happen to the stomach, food digestion will be disrupted.